menopause. And I think there's a lot of things, a lot of areas about this subject that people just don't know a lot about. And so what I've tried to do is give you some facts and some things about menopause that you might not know. Now, some of the things you are going to know, especially if you've been through it, but there's a lot of things that can support a woman at this time that most people don't know about. So let's just talk about some of the basics first. I mean, it's, as you guys know very well, it's when menstruation ceases. It's usually not a single event. It can happen over 10 years. Occurs naturally from age 40 to 51. The average age in the U.S. is 51 when they transition into menopause. Many women show signs of bone density changes by age 40. So that would be like a pretty good indication that you're entering into that stage. By the way, is a bone density change a disease? No, it just happens. It happens to men too, not just women. Okay, so it's not a disease. It's something that just happens. The pharmaceutical industry's made it into a disease, but it's really not. Okay, in fact, there's an interesting statistic that most women don't know. I'm going to throw this in here. It's not really part of the talk. Is that when you change bone density abnormally in a woman, when you use pharmaceuticals to change it, increases your chances for breast cancer. And most people don't know that, but that's a fact, and that's one of I have that slide in one of my other talks. 80% of perimenopausal perimenopausal women begin skipping periods, and 10% of the women will just stop, just with no indicators. Changes in cycles can be pretty unpredictable. As ovarian follicles become less and less available, hormone levels begin to deviate. Most of you have probably felt that or experienced that. The thing is that causes feedback into this hypothalamic pituitary axis, which is the master hormone center of the brain, which causes changes in emotions in the way you feel. Now, estrogen is sort of the core issue around menopause. So there's 3 types of estrogen. There's estrone, which is a very weak form of estrogen. This is a kind of estrogen that your body secretes primarily in menopause. When it's before you go through menopause, it's estradiol, which is a very, very powerful estrogen. And that's 5 to 10% of your estrogen. And then estriol, which is 80 to 90% of your estrogen, which is estrogen E3, is come on in. Hi, Arlen. Is a primary estrogen that's secreted during pregnancy. So estrone is pretty safe, E1. It's estradiol that they for a lot of years they were giving women who are going through menopause. Estradiol, or estrogen, is a cell growth stimulator that makes cells grow. Now, if that's in the uterus, during when it's supposed to be there, that's a good thing. But what's the danger in giving a woman too much estrogen?
Cancer.
Yeah, causes cancer, the cell growth stimulator. So estradiol, of which Premarin is, it's horse estradiol, not a good thing for women, okay? And a lot of physicians stopped giving it to them back in the early 2000s because of that. So here's another thing that's really important to understand. Healthy adrenal glands secrete estrogen. They secrete estrone. Very important during menopause. If your adrenal glands are shot, Those are the women who hit the wall during menopause. Adrenal health, really, really important for female function and for going through menopause well. By the way, what are a couple of things that cause the adrenals to not function well? And if you've been to several of my talks, you ought to know this in your sleep. But what are some of the things that cause the adrenals not to work well?
Stress and high cortisol.
Yeah, stress. Well, stress produces high cortisol and adrenals. Yeah, stress, any kind of stress. What else?
Lack of sleep.
That's a type of stress.
Okay.
Yeah, but that would be one thing. Yeah, we're going to talk about that.
Could it be like your thyroid?
Okay, we're going to talk about that too. So adrenals really affect the thyroid, but it's a high sugar diet. Diet high in refined carbohydrates just beat the adrenals to death. Okay, so I know none of you've ever had that, but some people out there have. Okay, deficiency symptoms with estrogen: poor memory, mood swings, mental fogginess, vaginal dryness, urinary issues, decreased sex drive, reduction of breast size, poor skin health, loss of motivation. That's deficiency. What if you have too much estrogen? Estrogen dominance, excessive bleeding, headaches, migraines, emotional issues, gallbladder dysfunction. Too much estrogen thickens bile. Okay? How many women have had gallbladders out? Lots of them. Lots. Okay?
I have the dominance,
Yeah.
but I haven't had any of those issues.
Well, that's good. Okay?
I was like, whoa.
Thyroid dysfunction, PCOS, endometriosis, fibroids, all of that from too much estrogen. So how can we get too much estrogen other than like taking a supplement or an estrogen replacing drug? Yes.
Plastics.
Yeah.
In our food and water.
Exactly.
And plastics.
Yeah, plasticizers, insecticides, pesticides, all of that act like estrogen in the body. We swim in a sea of estrogen. That causes a lot of problems in men as well, a lot. Okay, so here's something that I want you to understand about this slide here, is that the liver is the primary organ in the body that gets rid of estrogen. If your liver's not working right, it's going to really be a hard slog to balance estrogen in your body. So tell me something that causes the liver not to work right.
You could have a fatty liver.
And what
Too much
causes
sugar.
that? Sugar. Sugar is always the answer. But a lot of the time it is. Yeah, sugar, fatty liver. Fatty liver from alcohol, sugar, okay? Or just a liver dysfunction due to too much vegetable oil in the diet, like canola oil, Crisco. That screws up the liver really good. So like French fries, okay? French fries, bad for the liver, okay? So yeah.
Unless you bake them.
Yeah, well, if you do it at home and you do it right, okay, you're good. Hey, Terry, come on in. So, rampant use of topical or bioidentical hormones can result in overaccumulation of estrogen in the tissues. That's why I don't use that stuff. I don't use it. I'm not saying it should never be used, but it's too easy to get too much and shut down estrogen production in your body. So one thing that I want to do, if a woman's having hormonal issues, support liver detoxification. Now, how do I do that? Okay, I use a standard process purification program. This is the most gentle, it's effective, and it works. Okay, so this is the process I use.
How often? Now I use one that has a multiple system. There's like 5 systems it overdoes, and then eventually one of those is a blood tube because it detoxes where the blood comes from. How often can you do those in a year?
Well, I don't know because I don't know anything about that product. I know nothing.
It depends.
This
Okay.
one you could do a couple times a year. This is this is a whole food, real effective cleanse, and I've seen hormones just snap back into place when women do this. Progesterone, produced in high amounts in the ovaries in the reproductive years, also produced in the adrenal glands and adipose tissue during menopause. But if your adrenal glands are shot, okay, not going to happen, okay? You need that progesterone from the adrenals. And synthesized, it's always synthesized from cholesterol and pregnenolone. So if you're on a cholesterol-lowering drug, can your body make hormones as easily? No, can't do it. That's why I hate statins. I hate them, okay? Because they reduce the raw material your body needs to make hormones. I would never go on a statin. I don't care how high my cholesterol got. I just wouldn't do it. Now, entering perimenopause. So this can occur a long time before menopause, and sometimes changes in emotions are the first symptom or sign. A woman's cycle can still be normal, but she can have these emotional ups and downs. A decline in progesterone production, the first change to affect woman heading into menopause. So what happens is if estrogen starts getting low and the adrenals can't kick in, you start getting estrogen dominance, and that's when you get those real emotional swings.
So that's normal for it to go down and the estrogen to stay up?
Well, it shouldn't, because your adrenals should pick up the slack. But if your adrenal glands are not producing estrogen or progesterone, can't do it, okay? They can't pick up the slack. And a lot of people's adrenals can't do it because of the way they eat, the amount of stress they've been under. Their adrenal glands just aren't working like they should. Anybody that has blood sugar issues has adrenal glands that are not functioning like they should. I can tell you that right now. So, accelerating symptoms of menopause, okay? Vasomotor instability, that just means hot flashes. That's just a fancy word for that. Insomnia, mood swings, atrophy of reproductive tissue, pain with intercourse, sugar cravings. I know none of you probably ever had those, but some people have, okay? Fatigue, poor adaptability, memory loss, difficulty concentrating. So up to 75% of perimenopausal women are uncomfortable enough that they'll try things that are non-traditional medical. So, you know, I think this is a really good way to start. Dietary and lifestyle changes, very good way. Acupuncture, exercise, herbs, supplements, bioidentical hormone use, and other alternative treatments. A lot of women try that stuff. Here's some things that can cause premature menopause. Obviously, surgery, okay? But chemotherapy can cause menopause. Radiation, excessive stress, emotional trauma, ovarian failure, and that can happen for reasons that we don't even know, okay? And functional disorders. So what would be a functional disorder that could cause premature menopause?
Endometriosis?
Could be, yeah.
Fibroids? You said fibroids.
Yeah, fibroids. I was thinking of, like, you know, a significant amount of, like, vitamin mineral imbalance or deficiency in the body, you know. Those types of functional disorders could be even something like, you know, severe food intolerances that you're unaware of could really cause disruption in the body. Functional disorders include PCOS, like you said, endometriosis, malfunction of the hypothalamus or pituitary cancer of reproductive organs, ovarian dysfunction or insufficiency. Now you see a lot of this in young women who can't get pregnant, and that's something that I can really help them with from a functional nutritional standpoint. I can really help a woman who has this to help get that area of their body working better again. So we want to look at the underlying hormone imbalance or neurological deficiency and correct that. Lifestyle management, obviously really, really important. As we talked about stress, emotions. If a woman has never had a really healthy monthly cycle, she's going to have a tough time with menopause. And what would cause a woman not to have a healthy menstrual cycle from early on? Stress. You think young girls are under stress right now?
Yeah.
They're under a lot of stress, a lot. I mean, just ridiculous amounts. Okay, what else? Alcohol? Sure, certainly. What else?
Your
Smoking.
health, your diet.
Diet, that's it. Yeah.
Overweight.
Yeah, overweight. And usually that can be hooked into diet. So what is it about the teenage diet that's so bad?
Soda pop.
Yeah.
Pizza.
And
good.
pop. Right.
Sugar,
Yeah.
everything.
Yeah. It's like most of what they eat and most of what they're told to eat on TV is terrible for people.
What about the hormones in milk products that are hormone free?
Absolutely. And that's why I tell people, don't drink milk. Bad. Milk is to take a 20 or 120 pound calf and turn it into a 500 pound cow. It's not good, so don't drink it. Yeah, you're right. Milk, hormones in a lot of things that we have. So somebody who's not fit, that can affect it. And then some of these other ones. Change in brain chemistry. Perimenopause, once you start going through this, you have alterations in brain chemistry, which really changes a woman's perception of the world. So estrogen and progesterone receptors are rich in the brain, especially, this is the area, amygdala, hippocampus, temporal lobe. That's the area of the brain that helps us regulate emotions. The hippocampus is the heart of the limbic system, which is important for memory, hunger, sexual desire, and anger. Ensuring strong hypothalamus support can help tremendously with emotional disruptions. How do we do that? How do we ensure hypothalamus support? How would we do that?
Better diet.
That would be something that would be really helpful.
Be the start.
Anybody know the key mineral for the hypothalamus?
Keep thinking of the brain, which is fat, but it's not fat.
It's manganese.
Oh,
Yeah, manganese. Okay, so another thing is there's products that Standard Process has that are designed specifically for the hypothalamus. So when I have a young female that can't get pregnant, it's one of the things that she gets is a product called Hypothalmex, which helps the hypothalamus work better. Okay.
What about the hippocampus?
Hippocampus, that's up higher in the brain.
But if that's not functioning correct and you have those issues, what do you do for that?
The hippocampus, that's a good question. I would probably do things like vagal nerve and frontal lobe stimulation with a product I have called the Stim Pod.
Mm-hmm.
I would do that. I wouldn't, I don't have a supplement for the hippocampus. We have some supplements for brain. I don't know how that would work for that. So I wouldn't even use a supplement for that. I just stimulate the brain and see if that would work. That's what I would do personally, at least. So there's a link to the thyroid. Now we're getting to the thyroid. Thyroid issues are common during perimenopausal years. About 26% of women are diagnosed with hypothyroid during perimenopause. Part of the big problem here is some of the estrogen that they're taking, or they may be taking, and adrenal dysfunction, which we'll get into right here. There's a thyroid-adrenal link. Okay, thyroid tests can appear normal, and I've seen this, yet when the patient experiencing symptoms that seem to indicate hypothyroid, what happens is that one of two things can be going on. Number one is you have an adrenal issue that's pulling down the thyroid. Number two issue is you might, if you have a normal thyroid test, which is normally done with the TSH, which is really a pituitary test and not a thyroid test, is that if you have a normal TSH but you have thyroid issues, you could have a normal TSH and have autoimmune thyroid disease. And I've seen that many, many, many times. Okay? So the autoimmune markers should be checked. And then you need to deal with that. Okay?
Do you do that here at all?
Yeah, I do it all the time. So what would be the one food that you need to be off of if you had an autoimmune thyroid? Who can answer that question? It's not sugar, okay?
No, it's your,
Yes.
it's your cabbage and, isn't it broccoli and those that you should eat
Okay,
a lot of?
that's good. You should eat those things. What shouldn't you eat? What's the one food, the one substance you need to get off of if you have autoimmune thyroid? Wheat and gluten. Got it? Yep.
Oh, I'm
Wheat
already
and
off
gluten.
that.
Wheat and gluten. Okay.
Woohoo.
So, this is something I already talked about. Your adrenal glands are your backup system. Too much stress just beats them to death. And so adrenals, really important. Now, the role of the nervous system in hormone function. These all have a nerve supply. Thyroid, C7, right at the base of the neck. Adrenal, middle of the back. Ovaries, lower part of the mid-back. And there's some overlap here. The brain and pituitary gland greatly influenced by what happens at C1 in the neck. So spinal issues can contribute a lot to these. It's not always the case, but it certainly can contribute significantly, and I've seen that. So let's look at, this is what it's supposed to look like. The pituitary gland is in the middle, directing the thyroid, the adrenals, and the ovaries, and in a man, the testes. You should have this perfect triangle here. So what happens if the adrenals are not working? That's going to throw this triangle off, and it can affect the thyroid and the ovaries. So this whole triangle is called what's called the HPA and the HPO and the HPT axis. Hypothalamic, pituitary, thyroid, adrenal, and ovarian axis. So when I see a young woman who can't get pregnant, I work on the hypothalamus, the pituitary gland, and the ovaries primarily. I may give her some adrenal support as well. But that's the part that I work on the most. So if you have sex hormone dysfunction, now you have thyroid, sex hormone, and adrenals, or adrenals and sex hormones that are off. And finally, if the thyroid's involved, the whole thing gets thrown out of kilter. And you really have to work on supporting these organs, in other words, in order to get these back to normal. It's pretty hard for somebody who's going through menopause, if all these areas have not been working for a while, to go through that successfully and feel good. Really, really difficult. And what I do, and this is what we're going to talk a lot more about in part 2, is how do we fix this stuff? How do we get things working right? Okay? And that's a whole different talk that we're going to do in a couple of weeks. So one of the things that I would do is we want to restore adrenal function. I'm not going to talk about how we do that. But one way you could do it is decrease stress, change your diet, and then there's some specific supplements you can take. You want to balance sex hormones. Again, I do that through supplementation primarily, and supporting those organs with specific supplements. So, and there's a product that I'm going to start using that I've heard is really, really good. I haven't tried it yet. I've ordered it. It's called Feminine Advantage, and it really supports this whole triangle here. It's supposed to be very, very good for hot flashes. So if the thyroid is off, then we want to support thyroid function, okay? So we want to restore endocrine balance as much as possible. So this is part one of this talk. Does anybody have any questions?
If you don't have any of your uterus, ovaries, but you need estrogen, right? So you have to supplement that, right?
You might, yeah. You might, yeah. And so you want to support the adrenal glands for sure. But in that case, you may need some bioidentical estrogen. But you got to be careful with it.
Can you just take progesterone to kind of balance out the estrogen?
If you're getting estrogen, you're going to need progesterone to balance it out.
But if you don't have progesterone, if your progesterone is low and your estrogen is mediocre, wouldn't you have to take progesterone?
Yes, you would. And if your progesterone is low, you're probably going to end up with symptoms of estrogen dominance. You might even have normal estrogen or normal low estrogen. But if your progesterone is too low, that's to balance that out. And you're going to have some issues. You're definitely going to have issues. And again, you need to look at how well are your adrenals functioning. And if you've had those organs out, there's been some stresses in your life that cause that. So your adrenal glands may need some help. And sometimes it can take some time to get your adrenal glands working right again. And as we get older, that tends to go downhill a little bit. So you have to keep those in good, as good a shape as you can. And so there's, again, certain nutrients like B vitamins, a good B vitamin complex, vitamin C, really good for the adrenals. I have probably 7 or 8 adrenal products that are really good. I just have to match them for the right person. Ashwagandha, very good for adrenals. Licorice is helpful for adrenals. There's lots of things that can help them, but not everybody needs the same product. Everybody's different, so depends on where you're at nutritionally.
So, I started out with stress when I was 23 after my mom died, and that's where I started getting irregular cycles. I'm getting heavier and more often, less in between, more often.
Which is too much estrogen.
Yeah, so I started there for years. And then I think I started a little bit of perimenopause after 42, for sure, somewhere about 44. So
about the right age.
Yeah, and it got really high, and I was at a marina for a while, which gave natural progesterone. So I hardly didn't have a period for a while. And then when I came off of that after 10 years, then it was like crazy. So I didn't really know how to deal with all of that, and I just really couldn't afford anything at the time. But when I started taking supplements, I started looking at my health. I can't do everything at once, just not built that way. I'm slower. So in amongst all of this is where I'm at. I do take the the sea kelp for like iodine and stuff like that. I do ashwagandha. I also take licorice. It's actually in one of my supplements to help my sinuses. And you said something else to take. So I've cut back on sugar. I don't eat a ton of sugar anymore, and just really changed everything. So my brain fog has gone down, and I'm not as up and down as I was. It's like everything has kind of changed in my periods. They're like, I still have them, but they're a lot less.
Yeah, so it makes a difference, doesn't it?
Is that a good sign that I'm on the right track
It's a
of
really
treating
good
myself?
sign. Yeah, it's a really good sign.
I just did a lot of research is what I did.
Terry, you had a question.
Yeah, my question is with the hypothalamus, you need more manganese. What foods are high in manganese that you can eat that, in your diet, like a regular day?
Nuts.
Okay.
Yeah, nuts have high in manganese. And I don't remember all the foods right off. I have to look those up, but I know nuts are. Yeah, okay. Nuts are generally high in manganese. Yeah, okay. Manganese is a very safe supplement too. It's really hard to get too much of it.
Is there manganese in cauliflower?
Probably, but I don't know. I don't know right off the top of my head. Yeah, but there's like nuts and seeds are really high in minerals, so you can. You can't go wrong
Pick
there.
whatever seeds you want. Okay.
Yeah, right. Do you have a question?
I was just wondering about licorice. I was told that licorice can be toxic if you have too much of it.
None of the supplements that I have too much licorice in. And I don't think it's nearly as bad as what we've been taught. Okay. Most of that has come from like the pharmaceutical industry, the medical industrial complex, and I don't know of anybody that's OD'd or had problems with too much licorice.
Because some of the detoxes I've used before have licorice in
them. Yeah, our bodies can handle licorice. I think there's a lot more problems with some of the estrogen products that physicians have put their patients on compared to like something like licorice, or some of the pharmaceuticals that even pregnant women take. I'm like shocked that any doctor would prescribe them, because what's that going to do to their unborn baby? And so I worry way more about that than I would about some licorice, so. Most of the natural products are pretty safe most of the time. There's some things you can't give to pregnant and lactating women. I always look that up before I give things out. There are some herbs that aren't good, but what are you going to do? Tell a woman she can't have vitamin C? You know what I'm saying? It's like, so I don't think licorice I don't think it's the boogeyman. Let's put it that way. Yes, Arlen?
Does vitamin C increase blood sugar?
No.
No.
Should not increase blood sugar. No, it doesn't. Anybody else? Good. Okay, great. So, many of you may know some people that are going through a perimenopause or menopause that may need some help, and have them call our office. I'd be happy to sit down and talk with them and see what we can do for them, okay? And sometimes all they need is to change their diet. That's all they need, And I had a patient come in to me, this is, 6-8 months ago. She had some issues, and so I presented this plan. I said, well, we could do these tests, see where you're at, or you can make these dietary changes and see what happens. So I didn't hear from her. She left. I didn't hear from her for a long time. And then she left a message on my answering machine a couple of months ago, and she said, I made those dietary changes that you recommended, and all my symptoms went away. That's all she needed. She didn't. I don't think she got any supplements from me or anything. I think she just changed her diet. She needed to, and that's what did it. And a lot of times, just now, if you're really, really, really deficient in several things, dietary changes aren't going to be enough. You need to supplement, but for a lot of people, just fixing their diet's going to help them a lot. So anyway, so in 2 weeks, we're going to do in a month. Carmen's shaking her head.
Yes,
In a month, we're going to do part 2 of this. We're going to talk about what nutrients do we use? What products do we use to fix some of these problems? What do we do to support some of these issues? And so we'll talk about that in a month. Okay? So thanks for coming.